everyone, and welcome to the Wakefield Housing Support Evaluation Project presentation, or the WHoSE project. And my name is Ellie Holding, and I'm a Research Associate at the University of Sheffield and PI to this project. Bit of background to the project first. So it's widely known that timely transfer of care from the hospital to the home is vital for improved health outcomes. But this is dependent on the right clinical decision-making and on connection with the correct housing and community support solution for the patient's needs. Common barriers to hospital discharge include lack of options for appropriate housing, care packages, and adaptations. For example, there were a total of 155,717 delayed days in February 2020 alone, of which 41.8% was attributable to housing-related/social care issues. Due to this, increasing attention has been given to the potential role of housing providers for reducing health inequalities and demand for hospital services. So this background is why this current intervention was introduced. So the intervention is set in two hospitals, one being Fieldhead Hospital, which is a psychiatric inpatient unit run by South West Yorkshire Partnership NHS Trust, as well as Pinfield Hospital, which is an acute hospital run by Mid Yorkshire NHS Trust. In partnership with Wakefield District Housing, which is a housing association, both trusts agreed to run a pilot in 2018/19 to test how the introduction of a housing support coordinator, or a HSC, based in both hospitals could help facilitate hospital discharge. The housing support coordinator's role is quite broad, but usually they'd work with hospital staff in order to provide housing advice and support at the earliest opportunity for people in hospital to stop them reaching crisis point, and to help facilitate an efficient discharge to appropriate accommodation in the community. For example, by arranging supported accommodation, by helping people with benefit claims, or helping with home applications. So the evaluation aim, in partnership with the Housing Association and the NHS Trusts, is to understand whether and through what mechanisms and to what extent the Housing Support Coordinator has an impact on service users, so for example on their health and well-being or housing situations, as well as the process of hospital discharge, for example, on reductions in non-medical delays to discharge. So our study design and methods, we're employing a mixed methods process evaluation to understand the nature of the role and its potential impact. And there is 3 strands to the work that we're doing. One is survey data collection and routine data analysis. So we've actually created 3 surveys. One on referral to the service, which includes questions on patient demographics, reasons for referral, and also some validated housing related questions. A second survey to be completed approximately 2 months later, which includes the same validated housing related questions so that we can compare impact over time, as well as some more questions around patient experience. And then a third survey, which is an amalgamation of surveys 1 and 2, which we'll be sending to all people that have been discharged from the service. And along with this, we'll also be analysing routine data already collected by Wakefield District Housing. We're also conducting interviews with the housing support coordinators in each site, as well as key Wakefield District Housing staff who've been involved in the delivery of the intervention, as well as service users and hospital staff in Fieldhead Hospital. We're also going to be conducting an economic evaluation to assess the costs of the intervention. So as this is an evaluation of a hospital service, as you can imagine, COVID-19 has had quite an impact on this project and has resulted in changes to housing and NHS service delivery, making an already quite complex intervention even more complex to evaluate. And this has resulted in project delays and multiple changes to the project approach, including 4 ethical amendments to NHS ethics. Now, if any of you are familiar with NHS ethics, you know how long this process can take and how much work it can take. But because we've built this really close collaboration with our NHS and housing partners, we were actually able to launch the study, although this did happen 6 months later than originally planned. So our planned dissemination, we will be producing a report for housing and NHS partners, as well as a mixed methods academic paper in a housing and health related journal, and a 2-page policy briefing summary aimed at practice partners and service users, which will be available on the School of Health and Related Research's website from around January 2022. And we'll hopefully be presenting the results in regional and national conferences also. Thank you very much for listening, everyone. If you've got any questions, please join me in the FES breakout session, or feel free to email me at e.holding@sheffield.ac.uk. And I just want to say thank you to all of our collaborators, which includes SOFA researchers, practice partners, academic partners, and of course, our PPI representatives. Thank you very much for listening.